Welcome everyone to our channel where we strive to provide helpful information and promote mental health awareness. Today's video is a very important one as we'll be talking about a topic that affects millions of people worldwide. And today's topic is depression. And so today we're going to be looking at its depression, its symptoms, and the treatment options out there. So if you're ready, let's get started. It is essential to note that depression is not just feeling sad or down from time to time. It is a serious medical condition that affects a person's mood, thoughts, and overall well-being. And if left untreated, could lead to serious consequences. Now, are you aware that depression can present from adolescents to early adults, and that studies have shown that females are 2 times more prone to depression than their male counterparts? With this, we're going to be looking at how to spot depression in people. So here are some tips or symptoms rather to watch out for in depression. How to identify depression. So here are some symptoms to watch out for when looking for depression. Persistent feelings of sadness, hopelessness, or emptiness. The next symptom is loss of interest or pleasure in activities you once enjoyed. The third is fatigue or loss of energy even with minimal exertion. Changes in appetite and weight either increase or decrease. Difficulty concentrating, making decisions, or remembering things. Sleep disturbances such as insomnia or excessive sleeping. Restlessness or irritability. And then you have recurring thoughts of death or suicide. Now let's discuss the treatment options out there for depression. It is also worthy to note at this point that with depression there is no one treatment fits all, because everybody's experience with depression is unique, and so it is good that you seek the services of a qualified healthcare professional so they can check for what suits you, the right combination of therapy or whatever treatment options that you choose to suit your personal needs. There's a lot of treatment options out there, but for this video we're going to be looking at the 3 most common treatment options for depression, and that is therapy, medication, and lifestyle changes. Talk therapy such as cognitive behavioral therapy, CBT, is highly effective in the treatment of depression. This is because it helps individuals identify negative thought patterns, develop coping strategies to handle them, and gain better understanding of their emotions. Now, the question would now be, can anyone administer talk therapy? Talk therapy is administered by psychiatrists, qualified psychologists, trained and licensed social workers, licensed family and marriage counselors. But where you cannot get this, just look for somebody to talk to. But the important thing is, if you are depressed, talk therapy will help you. And so get a licensed person in psychotherapy and begin the process of your treatment so that you can identify the negative thought patterns and develop strategies with which you'll be able to handle them so that you can walk free from depression. The second treatment out there is medication. Now, antidepressants can be prescribed by a psychiatrist to help regulate brain chemistry. It is important to know that you are not supposed to take self-medication. You're not supposed to treat yourself. If you are depressed, seek the help of healthcare professionals. They will come up with a treatment plan that will suit your issue, the depression that you're going through. And remember, treatment of depression takes time. And so it is important that you stick to your treatment plan. Once a treatment plan has been prescribed for you, do not stop your plan halfway. Stick to your treatment plan, take your drugs, and be patient. If for any reason the drugs are not giving you the desired result, go back to your doctor, go back to your healthcare professional, and they will see what adjustments need to be made to give you the desired result. So please do not self-medicate and stick to your treatment plan. This is very important. And also note that treatment of depression takes time. So do not rush out of your treatment. Do not stop your treatment halfway. Treatment number 3 is lifestyle changes. Adopting a healthy lifestyle can go a long way in the treatment of depression. Regular exercise, eating balanced diet as nutritious food, having enough sleep, taking your tasks in bits so that you don't get stressed out, prioritizing tasks, and celebrating small wins will go a long way in the treatment of depression. Set realistic goals and milestones for yourself so that you don't push yourself beyond the limit. And avoid alcohol and the use of recreational drugs, as these tend to push you overboard. If you think there are other helpful treatment options other than the ones we have discussed today, feel free to state them in the comment section so we can have a good look at them. That wraps up our discussion on understanding depression and the treatment options available. I want you to know that seeking help is not a sign of weakness, but it's a sign of strength. You don't have to keep silent and watch depression destroy your life. Speak out. Remember, treatment of depression is not a one-size-fits-all approach. And so it takes time to find the right combination or right option in the treatment of depression. So, like I stated in the beginning of the video, seek help from qualified medical professionals. And whatever medication you have been prescribed, please follow through with them. Do not cut your medication and do not self-medicate. Very, very important. Avoid the use of recreational drugs. They go a long way in harming you instead of helping you. Patience. And don't hesitate to communicate openly with your healthcare provider about how you feel. Thank you for watching, and please remember to take care of your mental health. Don't forget to like our video, comment, and share, and even subscribe. Stay strong, stay positive. See you soon. Bye.